Two sets of action occur at the wrist: flexion, extension, which both occur along the sagittal plane, then abduction and adduction, which occur on the coronal plane. The joint is biaxial and it is a condyloid joint. So again, you have flexion, and two muscles that contract to do flexion are the flexor digitorum and the flexor carpi ulnaris. Then you have extension. Two muscles that do that are extensor digitorum and extensor carpi ulnaris. You have abduction. Two muscles that do that are the flexor carpi radialis and the extensor carpi radialis. You have adduction, and two muscles that do that are flexor carpi ulnaris and extensor carpi ulnaris. Two actions occur at the elbow: flexion and extension. The elbow joint is a synovial hinge joint that is uniaxial. When the hand is supinated and you flex the elbow, the biceps brachii is contracting to do this action. When your hand is in a neutral position and you flex your elbow, the brachioradialis is one of the main muscles involved. If your hand is pronated and you flex your elbow, the brachialis, which is deep to the biceps of the elbow and is the true elbow flexor, always has to contract when flexing the elbow, no matter what position the forearm is in. But it gets more help from the biceps and the brachioradialis when you are supinated or neutral. When you extend your elbow against resistance, one muscle that helps to do elbow extension is the triceps brachii.
This is the dip joint, this is the pip joint. They both do flexion and extension. Flexion, extension. This is the only actions that they do, so they are a uniaxial joint, and the movements occur along the sagittal plane, and each of these is a synovial hinge joint. These are the metacarpal phalangeal, or the big knuckle joints. There are two movements that occur, which are flexion and extension, and these happen on the sagittal plane. They also do abduction and adduction along the coronal plane. It is a biaxial and a condyloid joint.
There are two actions that occur with the forearm. It's pronation and supination. To start, you start in an anatomical position and turn your palm down to do pronation. And then to supinate, you're going to move your arm to where your palm is up. The synovial joint that the radioulnar joint is the pivot joint, and on a human, this would be pronation going to supination, and supination going to pronation. In a neutral position, going to pronation, and then in a neutral position, going to supination. The name of the muscle that pronates and supinates is brachioradialis. There are four actions that the foot does. The first is plantar flexion with the foot pointing, and two muscles that assist with that are the gastrocnemius and the soleus. The second is dorsiflexion, and the two muscles that help with that are the tibialis anterior and the extensor digitorum longus, which runs down into the toes. The third muscle is the third action is inversion with the toe or the foot going inward, and two muscles that assist with that are the extensor hallucis longus, which runs into the big toe of the foot, and the tibialis anterior. The next is extension, which the two muscles that assist with that are the extensor digitorum longus and the fibularis longus. The plane that the actions go through is the sagittal.
So right here we're going to have her extend her knee, and the four muscles that are involved are the vastus lateralis, the vastus medialis, the vastus intermedius, and the rectus femoris. And then we're going to have her flex her knee, and the four muscles that are involved in that are the semitendinosus, semimembranosus, bicep femoris, and the sartorius. And with the tibia, we're going to show you on the articulated skeleton, you'll see that the tibia slightly rotates out when the knee flexes and extends, and the knee joint is a condyloid joint.
These are the actions of the hip. The hip is a ball and socket joint. The actions include flexion and extension, adduction and abduction, and lateral and medial rotation. The first action is flexion. As you can see here, she is flexing her hip. Some muscles include the rectus femoris, sartorius, and TFL. The rectus femoris is on the anterior thigh, sartorius, and the TFL. This also lays along the sagittal plane. Next is extension, which is also along the sagittal plane. It can also be known as hyperextension. It includes the hamstrings, which are the semitendinosus, semimembranosus, and bicep femoris, which are along the posterior thigh. Next, she'll do adduction, which is along the frontal or coronal plane. Muscles include the gracilis, the adductor longus, adductor brevis, and adductor magnus, which is along the medial thigh. Next, she'll do abduction, which we'll use a TheraBand to assist in this action. Here you can see she's resisting against the band. This is also along the frontal or coronal plane. The muscles include the gluteus medius and gluteus minimus, which are along here. The gluteus minimus also lays beneath the medius. Next, she'll do lateral rotation of the hip. This is along the transverse plane. It includes the gluteus maximus, which is the main or largest muscle of the gluteus muscles, and the sartorius. And last is medial rotation, which is also along the transverse plane and includes muscles such as the gluteus medius and the gluteus minimus.
So at the shoulder, you have 3 sets of actions. You have, the first set would be your flexion and extension. Your second set would be your abduction and adduction. And your third set would be your medial and lateral rotation. So we're going to have her flex and extend her arm. So we're going to flex first. She's going to bring her arm up, and that's along the sagittal plane. And then she's going to extend her arm backwards. And the 2 muscles that help flex and extend would be your deltoid and your biceps brachii. Then with the adduction and abduction, then she's going to abduct first, and then she's going to adduct. And the 2 muscles that help with that are the deltoid and the trapezius, and that is along your coronal plane. And then the last one would be her medial and lateral rotation. So she's going to medially rotate her arm and laterally rotate her arm, and that's going to work the triceps brachii and the deltoid. And your shoulder is a ball and socket joint.